Hello, everyone, and welcome. My name is Julie Mann. I'm also known as the Habit Fixer, and I love helping women to regain their mojo and age well. I do that with EFT, which is a really simple tapping technique, nutrition, skincare, and digital products. And you're in for a big treat today because I've got such a lovely guest. Her name is Laura Walker, and she's a health and fitness specialist. And the thing about Laura is that she actually specializes in empowering women to manage their hormone health, menopause symptoms, and joint pain. So if you're suffering or you're with any of those things or all of them, you're in the right place. Hi, Laura.
Good morning. How are you?
Good. It's good to see you. I can't wait to hear what you've got to say. I know you're going to be talking about 3 habits to release pain, aren't you? Yes. So I'm just going to hand straight over to you.
Oh, okay. So, when it comes to things like pain, discomfort, or anything like that, then it's usually down to the way that you're currently moving, the current habits that you have. So, for example, if I'm sitting at the desk, as I am right now, I'm speaking at the computer, so I'm square and my arms are on the desk, all this. But usually I've kind of got one elbow on an armrest and one pen in my hand, and I'm kind of like, or I'm kind of like, I'm kind of rounded. So there's the positions that you're in all day, really, that will cause this kind of pain. So essentially, my first recommendation is just to take notice of what are you doing when you're sitting down.
So
What
what
position?
So Laura, it sounds like a really obvious thing, but obviously we don't do it, which is why you're
No,
actually, recommending that we do. So
absolutely.
how do we, is there some sort of structure or some sort of suggestion you have so that people can think, oh yeah, I need to be aware of what I'm doing? Because we just forget stuff, we get involved in stuff, and before we know it, we're in that old position again.
Absolutely. So you're 100% right. We don't notice because we do it all the time. 100%. We do it on everything that you do on a daily basis. You absolutely do not notice. But I always start with a client and say, right, what do you do? What is your job? Even if they're retired, what do you do on a daily basis? So clearly, if somebody is still working and they're working in a shop, they're standing up all day, or a hairdresser, they're standing up all day and they've got their arms lifted, or if they're sitting down all day, they tend to be rounded through the spine a little bit. If they're driving, they'll might be like this. So what is it that you do? What is your either employment, or as I say, if you're retired, then if you're lucky enough to be there, what do you do? So it's just being aware. That's the only thing I can say. There's nothing mechanical about it. It's just being aware that all of a sudden you're kind of in a position and you may be sitting thinking. I don't know about you, but I can sit quite still and think, and then all of a sudden think, okay,
Yes. Well, I'm
where
noticing, Laura, that actually I'm not completely square on. So I'm noticing that little bit, that kind of unevenness in either side of my body. But I'm only noticing it because you're drawing my awareness to it. So I'm becoming conscious. So I guess that's the thing. We
yes,
have to be conscious.
yes,
So
100%.
yeah,
100%.
and maybe that might be having a little a note in the diary that says mind your posture today, or a little alarm. I don't know. What is there some sort of way to remember? That's the thing. We have to remember, don't we?
I think sometimes when somebody has said, what do you do on a daily basis? You then start to think, well, what do I do on a daily basis?
Yeah.
How do and to start with, you kind of go, well, I just sit there. I don't really do anything much. And then over the days, over the weeks, you start to notice a little bit more. Oh, I do this regularly, do that. So for example, I went to see an elderly client and had difficulty with a head, neck and shoulder movements, that kind of thing. And when I was introduced to the lady, we were sitting in 2 dining chairs face on. Kind of like, right, okay. So looking at the lady, there was nothing untoward, that was fine. And I'm thinking, why is this happening? Why is this happening? And I said, so what do you do? Do you go out walking? Do you go out shopping? Do you do? No, people do that. Oh, no, no. Okay. And I'm like, there's something here. And then, do you drive? No, don't drive. Right. Okay. So what is it then? What is it? And I kind of looked around the house a wee bit, and I kind of said, oh, is that the chair that you sit in to watch your telly? And she said, yes. And I looked at it, and I looked at the telly, and I thought, right, so the telly is here, but the chair, instead of being like that, was like that. And I'm thinking, why would you do that? So she was actually looking at the telly like that.
Wow.
For hours on end. So that then has a whole effect through not just the head and neck, but clearly the whole spinal column as well, because she's got that little bit of a turn going on. So all they needed to do was just to square off that chair, and it would start to ease it. Now, clearly, there were other things that we did as well. We did a bit of therapy, we did a bit of strengthening, all that, but essentially just squaring off that chair to the television. And it's exactly the same with your computer, particularly for people who may have two monitors. They kind of go, you know, if you're looking at both, unless they're both directly in front of you, you're going to be at an angle at some point. And it's minute, but it's understanding, what are you doing on a daily basis? What's in front of you?
Oh my goodness, Laura, it's just made me realize that actually with my television, because I sit on the corner of my settee, that actually I must be doing a slight this is so useful. Thank you so much. It is those little things, isn't it? The habit of doing those little things. Yeah.
Absolutely. I had another client who drove an awful lot, and when they sat down, they were leaning against the central console with one hand. And they drive for hours like that. And you're like, but you're bending your spine, you're loading up on this position, you know, and if you're driving for hours, just... So every time I get into the car, I'm kind of like, right, just make sure I've got two sit bones down on that seat and I'm nice and square, and, you know, but clearly you need to take the breaks as well, because, I mean, if you sat there for 3 hours, then clearly getting out the car, I don't know about you, but I'm like, oh my God. Yeah, trying to get that fluid back into the joints to make your joints move now is a little bit more challenging than when I was 20. So,
would you recommend, Laura, a certain length of time to be sat at the computer? You know, no more than, or to be in the car for that? You know.
Yeah, length of time. So there is a recommendation in terms of sitting. When you sit, you bend the knees. Obviously you bend at the hips as well. So what that means is that your circulation has difficulty getting through to your feet, because you have obviously two right angles going on. So the recommendation is, and why many people wearing a Fitbit or a whatever, Garmin, whatever it might be, they might get a notification probably every hour to stand up and move around. But actually the health recommendation is to move every 30 minutes for a minimum of 30 seconds to a maximum of 2 minutes, every 30 minutes. And that's for your health. That's to get your circulation being able to come around. Now, I know when you drive, then, you know, trying to drive and stop every half an hour is not necessarily a great thing. So I personally have a rule of thumb of anything between an hour and a half and 2 hours. And even if I've got a 10-hour journey, I try and do an hour and a half to 2 hours block. So
you talked about 30 seconds and a maximum of 2 minutes, sure, or was it 2 minutes?
Yeah, in a 30-minute period, yeah. Yes.
I mean, I would probably get up for long. I don't know why there's a maximum in a way, but...
What I'm saying about maximum, it's not that a maximum you shouldn't do anymore. The maximum in order to get the health benefit.
Right. Okay. Yeah. Got it.
So,
yeah.
I mean,
of course.
You know, but just to get that circulation moving, it's that kind of time frame, really. But on the Fitbit, you'll have it every hour, so you'll get the Fitbits trying to, or whatever device you have, you'll get them saying it will move for at least 2 minutes or this many steps or something like that, just to get your circulation. And that's to maintain good health, because if you sit for 8 hours, you're really not getting that circulation going around very well.
Yeah. And actually, I don't have one of those devices, and there may be lots of people watching, listening, who don't have one. So just stick your mobile phone on, the alarm on, you know, that goes off. So tip number 2, What's your habit number 2, Laura?
So how do you stand up?
Mm.
It's a good one, isn't it? Yeah. And again, most people have no idea what they do when they stand up, how they stand up, but when they just stand up, you just get up, don't you? You don't think about the way that you get up. So, so from that perspective, you know the old adage, you know, you'll get to a certain age and people start saying, why do older people make a noise when they get out of a seat?
Mm.
Can
Why
you
do
tell?
you think?
Right. So it is because they're holding their breath and using the diaphragm as a stabilizing muscle. So you hold your breath, nothing's moving. You get so far up that you actually then need to breathe when you get to the top. And then you go, oh, and you get to
Wow.
the top. So other people then, particularly maybe an older person, might use their arms. So I'm fortunate I've got armrests here. So in order to get up, the arms are here and you push up through your arms. So your whole body weight, well, not maybe the whole of it, but a lot of the body weight is going through the arms. And what that does is reduce the load on your legs, and that might be fine, but actually we're not building any strength in the legs and we're losing strength in the legs. So the reason then when people get older, they're not able to get out of a seat quite so easily is because they've adapted all these things. They've held the breath, used the diaphragm, they've used the arms, so they've used everything else apart from the legs. So trying to stand up becomes difficult. So the one tip that I will give you is that when you stand up, no matter what age you are, continue to use your feet and nothing else. Breathe out as you get up.
Wow. I mean, it's just such an important thing, isn't it? Because the problem is if people lose the strength in their body to be able to be mobile, get themselves up off the floor if they fall or off a chair, then you know, their quality of life is much diminished, but also that's a massive, massive problem if they have a fall and they can't get up and there's no one there to help them. So it really is our responsibility, isn't it, Laura? And we don't think about these things. So I'm so, so glad that you're really highlighting all this stuff because it is basic, but if you don't know it, you don't know it.
Absolutely. And the thing is, you know, we are creatures who learn by watching. And almost to the point where, well, if you're elderly, that's how you move. And the older you get, that's how you do it. And you're kind of like, no, it doesn't have to be like that at all. And so, from that perspective, we can learn differently, we can do things differently, but we need to understand what's going on first to be able to choose a different method.
Yeah, absolutely.
And I think that's the thing. That's what I feel that I enjoy doing is empowering people with the right information to make those choices and think, well, we can see the next generation, which is something that a lot of generations before us have never ever had. It is about seeing, watching what's happening with that older generation. They're getting older, they're living longer, fantastic, but they could be a little bit more mobile, they could be stronger. So we can use that information now and be hopefully at their age, but maybe a little bit more mobile.
Yeah, yeah.
Give me a second, I need to switch something off.
Oh, okay. Well, I'm just going to chat. Yeah,
Can you?
and one
Can
of
you?
the things that I've been doing is in the morning, so I do some meditation, so I lie down for that. And I am very conscious when I get up off the floor that I just use my legs. I kind of cross my legs and then I push up. Um, and that's been really working for me. But I need to probably look at different ways of getting up off the floor. But you saying about breathe out when you do it, that is a really that's like a whole new thing for me.
Yeah, yeah. Because people do hold their breath. You kind of get ready to stand up. You go,
Yeah,
stand up, and it's using that diaphragm. So if you exhale when you get up, then you use your whole core to get up, and your body weight comes into the core. So it's really
Who
quite.
knew?
I know. I know.
Experts like you.
That's why I'm here.
Yes.
But yeah, I could probably give you a fourth one. I know we said 3, but I could probably give you a fourth one.
I thought that was 2, but clearly my
I know I haven't done the third one yet, but I'm just thinking of something else that's not relevant. It's another completely different, but it is relevant to this particular one. And what that is, so when you exhale and use your core, you can actually then brace into the belly to support your spine. So very many people probably get low back pain when they get up and down off a chair anyway, particularly if you sat for a long time. So people sitting will shorten their hip flexors at the front, which will pull on their spine and give them low back pain. So if you brace into your belly, exhale, stand up, you'll relieve that low back pain as well.
Excellent. Just a question actually about, you're saying about the circulation when you're sitting down. Is it useful to rotate the ankles, or is there something?
Yes, absolutely, because you're still getting that movement going, and actually, when you have mobility at the ankle, it demonstrates health through your vagus nerve as well. So as we get older, we tend to not get that mobility at the ankle, and so it tends to indicate that the vagus nerve, which keeps us healthy and alive and moving, isn't that great. So yeah, keep your ankles moving as much as you possibly can.
Glad I asked.
Yeah. Oh, I could be here for hours. You okay?
Just having a little coughing fit there. Just a reflux thing. Fourth habit then.
The fourth habit is,
Or maybe it's your third, whatever, a habit.
I know. So the last one that I've got is kind of walking. How do you walk? And for people maybe in their 20s or what have you, kind of want to just put one foot in front of the other and don't even think about it, which is great, which is exactly what I did. Walk for hours, walk for miles, brilliant. Never even thought twice about it, especially if you've got a dog, you just get on with it. But then as we get older, particularly through well, not just older, to be honest with you, so as women going through hormonal changes each month, our structures are changing as well. So for instance, we have, I'll speak about 3 different types of soft tissue. You've got your muscles, you've got the tendons which attach your muscles to your bone, but you've also got ligaments which bind your bone to bone. And in the second half of your menstrual cycle, which weeks 3 and 4, progesterone tends to be a little bit higher, which then the ligaments don't work quite as well as they should. So just before period would start, then you've maybe got low back pain, maybe got a bit of knee pain, all that kind of thing. And it is just the hormones. And because the ligaments are not quite as firm as they could be, we tend to get that looseness and that discomfort. The estrogen then comes back in on week 1 and we're all back to normal and it's all fine. So if you're kind of getting that just now, then it's really important to understand that your ligaments aren't supporting your joints in the same way. So doing strength training, doing aerobic and jogging and running and all that is maybe not where you want to be at that point, because your joints are and that's where you're more likely to get your injuries. And in fact, I think I'm right in saying that recently there were some studies that came out about female footballers just prior to the period starting, and ACL injuries. You're 6 times more likely to get an ACL injury at that point of your menstrual cycle than the next week, so to speak. So it's really important to understand where you are in your cycle, what kind of exercise to be doing. But then as we get older and we go through menopause and maybe come past it as well, hopefully, then where are those injuries? How are you walking? So for me, yeah, my ligaments are, I do have joint pain because of my ligaments. And so even if I don't have any discomfort that day, I'm still walking with a limp. And I stand there and I go, why am I walking with a limp? Because I don't have any pain today. Why am I doing that? And then I have to really consciously think how I'm walking. What am I doing? Am I putting my heel down? am I rolling my foot? Because very often, if you've had any kind of injury, so it doesn't necessarily mean it's a hormonal thing, it could be any kind of injury. And as we've mentioned already, somebody might have fallen and things like that. The fear behind walking can really alter your gait. And it's that altering that we need to be mindful of, because we need to be tall, we need to be strong, striking with your heel, looking straight ahead, which I know a lot of people don't do. They tend to look at the floor when they're walking. So how do you walk? What are you doing? Because if you're looking at the floor, that's where you're going to end up. You need to look at the horizon as you walk.
I'm so glad you've talked about this, Laura, because I know absolutely the importance. It all starts with the feet, doesn't it?
Yeah.
And you know, the rest of our body is aligned in accordance with what's going on, and it is vital, and it's something, you know, we're fortunate enough, for most of us, to be able to walk. It really is about walking well so that we age well. And you know, so when you were talking about your limp, what you're saying is when you notice, you become conscious you've got a bit of a limp, then actually you alter your gait so that you don't have that limp. Yeah.
Yeah. I have to be very conscious about the way I walk. Some days it's quite painful with my knee. Sometimes I can walk with it, and then all of a sudden it'll go, no, you're not doing any more, and I have to stop. But how am I moving with it? And I was doing an assessment yesterday, so I had to video myself before the assessment just to make sure I was kind of doing what I wanted to do. And in the video, I was squatting, I was doing a squat. And it was only because it was on the video I noticed I was squatting to one side. I wasn't squatting centrally. I was coming over to one side to protect my knee. And I thought I was coming centrally in order to really try and strengthen this knee. But no, I was protecting it, and I was sitting back to one side. So, you know, unless I'd done that video, I'd have gone, oh, I'm perfectly fine.
Yeah.
But we can just look in the mirror. What's our movements? How do we walk?
And it's useful for someone to video us just very briefly. Someone did that for me because I went to see an alignment specialist around about my neck, and she discovered all sorts of things immediately, which I was completely unaware of. But it's that interesting thing, isn't it? I mean, I love people watching. You know, if you're in a cafe, you're watching people walk by, and you kind of just see this. Everyone's got a completely different walk, and you know, it's really fascinating. And like you say, when we become conscious of what we're doing, we can alter that so that, you know, we can walk in a way that's much more beneficial to us. So I've got to ask you, Laura, what is an ACL?
Oh, ACL, I beg your
Jargon.
pardon. ACL is your anterior cruciate ligament. So in your knee, your ligaments, as I said, they bind your bone to bone, and you've got two, you've got an anterior and a posterior. So at your knee, they've wound themselves around to go further down the leg, but it's gone front and back. So they hold the knee joint together, basically. So when you kind of, if that's your knee, when you bend the knee, particularly when you come forward. So I think a lot of people might find that if they've got sore knees, it's going downhill. That's the problem, not uphill. And when they go downhill, it's the femur gliding along the tib and fib, and the ligaments don't have the support to stop it moving forward. So that's why most people will find going downhill more painful, difficult, all that, rather than go downhill.
Yeah. So what you were saying actually is, you know, I know you're talking about hormones and all sorts of stuff as well, but obviously this is really useful to any men watching or listening. Because yeah, that's going to be a lot of ouch, isn't it? But what you were saying previously, just to recap about the time of the month and the ACL, if in case there were people like me who were going, what's the ACL? What's the, rather than listening to what you were saying, just recap very briefly, please, on that connection.
The hormones.
Yeah.
Okay, so so for women, day one of your menstrual cycle is the first day of your period. So day one, that's when right the way through to around about day 14. There's a couple of phases in there, but let's just take the block as a whole, so to speak. Those 2 weeks, your estrogen levels are quite high. Estrogen is a growth hormone, and it's when you repair. And so when ladies are pregnant as well, you've got plenty of estrogen going around, and you know that's when people say, oh, you're blooming, you're looking so good because there's plenty of estrogen, because all this growth hormone is going on, which is clearly what we need. So if you've cut yourself during that time, then it's going to repair really quite quickly. But also, if you do strength training, endurance training as well, all that during those 2 weeks, do as much as you possibly can. So if you can strength train twice, 3 times a day, do it in those 2 weeks, because that's when your body is going to support your growth. In the second 2 weeks, it's when progesterone is a little bit higher. And progesterone, as I say, it tends to then, not make the ligaments not work quite so well. So you haven't got, so you can tell that adding load at that point is not a good idea. So we don't really want to do the massive resistance training. You can still exercise, but you need to do it in a different way. And what that would mean, and I was speaking to somebody on Friday about this, they're power lifters. So as she said, first 2 weeks, yeah, great, she can load up, absolutely go for it. But in the second 2 weeks, she hurt her back because she was doing exactly the same thing when progesterone was higher. So it's taken her a while to get back. She said, but how am I going to then train? I said, well, it doesn't mean to say that you stop, but you might have to support your back differently. So instead of doing a deadlift, standing up, and a deadlift is where you hinge from your hips and stand back up again, and you've got load, you've got a bar as well, so you're loading that back up. Instead of doing it standing, lie on your back and lift your legs, but keep your core engaged and things like that. So you're still getting, so if you're lying on your back and your legs are coming up, so this is your upper body, you're doing that, it's the same movement, but now you're supporting your spine.
Useful. So do men experience, I know you work with women predominantly, but do men experience this hormonal thing that affects their
not in the same shift, not in the same shift as women. So for example, rotator cuff injuries, they're very, very common in menopausal women and after. So around 50s, 60s, usually the rotator cuff starts to injure.
Can you remind people what the rotator cuff is?
So there are 3 muscles that are set right at the back of the arm here and underneath. And essentially, if I put my arm out and you can see, hopefully you can see my hand.
Yeah.
Does that.
Right, yeah.
But you can see the movement coming from up here.
Yes.
And so very often, if you've had a rotator cuff injury, or if you've got a misalignment through the shoulder, many people will do that from the wrist and the upper arm is stable, but actually it should come from here.
Mm-hmm.
So again, it's just being mindful of what does your body do and how does it do it and where is it coming from. So your rotator cuff, as I say, 3 muscles at the top here. They're very small muscles, and because what do you do that does that apart from open doors? But very little. So it tends to get weak and it tends to get injured and it's sore. But it's more prevalent in women than men at the ages about 55 to about 70, and then men catch up with us. So men do have a hormonal shift, but not in the sudden way that women would have it. It's more progressive for them, and it's then down to that aging process in that respect, or somatopause as it's called.
Somatopause, that's the aging process. Well,
Yeah.
I'll stick to the aging process, I think, Laura. What an education. That's been so brilliant. Thank you so much, Laura.
Very welcome. You're very welcome. If I've helped anybody, then I'll be truly delighted.
You sure have. So for any of you that are watching or listening, Laura's links will be down below this video, as will mine. So check her out, ask her a question, find out more. What a wonderful woman she is. And if you have enjoyed this video, please subscribe, because there'll be plenty more people talking about other habits that are going to have you age well. And, if you know someone who's really struggling right now to get up off the floor, or maybe they are stuck at their computer, or maybe their walk's a bit strange and you've noticed that, then why not share this recording? So thank you ever so much, Laura, once again. And thank you everyone else for watching.
Thank you for having me. It's been an absolute pleasure. Thank you very much, Julie.